Hello everyone, I'm Dr. Priyank Patel. I'm a consultant spine surgeon working in the city of Mumbai out of multiple various super specialty hospitals. I'm one of the founder members of the VR Spine Practice Group. Apart from that, I am also a part of the Spine Foundation. I'm one of the trustees of Spine Foundation and have been associated with it for the past 10 years. Technically, Spine Foundation is a fund which has been set up 25 years ago with a prime motto of helping patients in need of spine care. Over 25, it's actually a registered NGO, but over 25 years, it has accumulated to become a group of spine surgeons with a similar thought process of giving back to the society. And over years, multiple spine surgeons have joined hand along with other paramedical staff, medical staff, and something which started off as one man's dream has now become a big organization spread all across the country. Spine's Foundation essentially was a fund which was started to help patients in need. So it does provide financial assistance to patients specifically in need of spine care. But above all else, it is a group of spine surgeons who are dedicated to providing spine services at the grassroots level. So basically, what we intend to do is we give out our time, our expertise to set up spine care services in areas which have not been tapped, where there is infrastructure but there is no manpower, no technical skills. So we access those areas, identify those places which require spine care, give out our time, travel across the country, go there, train the local doctors, uh, raise awareness about spine surgery, help train them, operate over there, and eventually make it into a running spine center and move to another center. Once a center is established, one doctor of the foundation takes ownership of the center, just like how a mother would raise the baby. The doctor would raise and grow the center, and effectively over years, there are countless centers which have been set up all around the country, uh, in almost every states, especially targeting those areas which drain a lot of tribal populations, or populations which are not able to reach the mainstream second tier or third tier cities. I think one of the biggest challenge that we have faced when we meet the tribal and rural patients is suspicion. They always look at you with that suspicion that why a group of doctors having fantastic practice, living a very cushy life in few of the best cities in the country, would want to come to their area which barely has anything, want to give their time out to treat them. They are suspicious of this, and it takes a lot of effort for us to convert their thought process and make them understand that we are genuinely there to help them without any vested interest. well uh, over the course, I have seen, I'll quote an example of one of the centers which is running in the center of the country, and that's in Gadchiroli. Gadchiroli is famously known for the Naxalite activities which used to be there, where people were even scared to step in. Is an organization called as Surge, where years back we started off with a spine center. Years back we had that problem where again the people were not trusting, they were not sure why we would want to come to their forest and treat them. uh, that was the time where we actually used to go in their villages from door to door, trying to find out if any people have problems pertaining to spine, something that we can help and correct them. Gradually, people started developing trust after several visits. Uh, Once they started trusting us, they started coming to the hospital. Uh, like converting the first patient and explaining how important surgery is for them and how it would change their life was a mammoth task. But once the people started opting for treatment, started getting better, and the word started spreading gradually, from where we had to really take efforts to grab patients and catch patients who need our care and tell them that don't live a life of disability, to a situation where we are now sitting in the city of Bombay, uh, doing video OPDs, teleconsultations with the tribals of Gadchiroli, and then going once in 3 months and operating on 20, 30, 40 patients at a time. That is a big change that has happened over the past 10 years, and this has happened right in front of my eyes. Well, actually, education and awareness both are very important to promote spinal healthcare. Uh, Education, because if we educate these people about spine, what role does it have in people's day-to-day activities, the various conditions that can affect the spine, and eventually the end result of a patient disabled because of a spine condition. Once we are able to educate them, that opens their eyes, and they are much more would want to then get themselves treated by creating awareness that a system like this is available, where people with these spine ailments can be treated at a very affordable cost, and the results are also very predictable and safe. More and more people who need this service are able to avail it. So yeah, education and awareness both are very important in promoting a good spinal health in the community. A lot of people actually ask us why, if we are doing a charitable work, we are in social media. Why are we guys trying to talk to you all? Well, remember, a adivasi sitting in some some forest, or some domestic worker who is working hard to make ends meet, will not really be following us on Instagram and listening to all of these things. But you guys are the educated lot. You guys are the influencers. You guys are the people who are in touch with such individuals who require such help. The reason we are doing all these things, the reason why we are here and we are talking to you, is you should help us spread this word. You should help people who need this type of services. That don't get dejected. There are options available. You can reach out to the Spine Foundation, and any and everyone who reaches out to us who needs our help, I assure you that we are there for them and we have their backs. Thank you.